I actually chose osteopathic medicine because I really started to develop a sense of, yeah, there is something different. And a lot of it comes with the way that we do use our skills that we develop through our osteopathic manipulative treatment, and just tying that into the overall philosophy kind of brings it together so that we're looking at the whole patient, not just a set of symptoms. I think as a new graduate from medical school, you do feel a pressure to know everything that's going on about your patient and have all the answers. But just trusting the fact that you have a solid education and you can trust your skills, your hands and your palpatory skills that we learn in school, along with your background that we receive in medical education, your tools are all there. Your first 2 years you're spent primarily in the classroom, and you do a lot of studying. There are tests that come every month rather than every quarter that basically keeps you in that study mode. You're dedicated to the books and to hands-on learning in the OMT lab. I think you spend pretty much 80% of your time studying and learning, and the other 20% you're actually out working on patients in community preceptor offices, applying those skills you're learning on a regular basis to community medicine. When I was a student at ASCOM, they had what was called an integrated medicine, and they would have group lectures that involved the PAs and the pharmacy students and the biomedical science students. We would all get together and have group lectures once or twice a month about different community medicine topics. Because as a team, we're all providing care for our patients, and you need to know what resources are out there for you. And just as the pharmacy students need to know what osteopathic physicians are, I think we share in that common goal. I think the faculty at ASCOM, they are amazing at their ability to be approachable and their fund of knowledge and just their willingness and hunger to teach us and what we do. I think that the strength of the program does come from the faculty and their investment that they have in the student.
With regard to how I'm doing,
I definitely felt like we were treated as colleagues here by the faculty. It was also an open door policy that we could come in and we could talk about clinical issues that may be going on. And the fact that these are faculty that are out practicing, you know that what they say is pretty much the real world. It's what we're going to experience when we become physicians. And as a graduate of the program, I've actually even worked with some of the faculty in the emergency room, in their family practice office. It's just an added benefit to the students to be able to continue on into a residency if they choose to stay in Arizona, to continue to work with the faculty that they've developed relationships with. Coming into medical school, you're never quite sure what your class is going to be like. I think in my situation, we're very fortunate to be a very close class. You do spend your first and your second year, and you pretty much get to know everybody, and you know that they're there for your support as well as you for them. I think the school really maintains a non-competitive environment. I think we're all working as a team with common goals, but we also would continue to go out and do volunteer activities that the school had put on together. I think our campus is growing. There's a lot of activities going on here on campus. If you're living on campus, a majority of us lived off campus, but we would get together and we'd do recreational softball leagues. There'd be basketball tournaments, and just families would get together and socialize on a regular basis. I think that time is precious, and we took advantage of it. My experience here at Midwestern was exactly what I was looking for. I think all of my expectations were met. Definitely feeling prepared, having fun, and enjoying my time here. I think it would be the best way to sum it up.